All right, now we're going to be talking about section 6 of chapter 14 on the spinal cord with reflexes. For learning objectives for this section, you should be able to describe the properties of a reflex, explain the general function of a reflex, list the structures involved in a reflex arc and the steps in its action, explain the 5 ways a reflex may be classified, name and describe 4 common spinal reflexes, and explain the indications of a hypoactive versus those of a hyperactive reflex. So, with the characteristics of reflexes. Reflexes are just rapid, pre-programmed involuntary responses of muscles or glands to a stimulus. A stimulus is required to initiate this reflex. The response is rapid, involves a chain of only a few neurons. The response is pre-programmed, always the same. The response is involuntary, no intent or awareness of the reflex before it happens. A reflex is a survival mechanism, and we respond to a potentially detrimental stimulus immediately, and awareness comes later. The components of reflex arc. A reflex arc is a neural pathway that's responsible for generating the response. In this case, we have a stimulus that activates the receptor, here in this case at the skin, and then the information, of course, travels. This nerve signal is propagated through the sensory neuron to the spinal cord. Nerve signal is processed in the integration center by interneurons, and the nerve signal is relayed to the brain by interneuron collaterals. And of course, as well, you're going to have this, then the nerve signal is propagated by the motor neuron to the effector, and the effector responds. In this case, the biceps. What we're looking at here is being the response to bend the elbow, flex the elbow. Classifying spinal reflexes, they vary, and they can be classified in a few different ways. So if they're spinal or cranial, is the spinal cord or brain the reflex integration center? Is it somatic or visceral? Is the effector of a skeletal muscle, or is it cardiac muscle, smooth muscle, or a gland? Monosynaptic or polysynaptic? Do sensory neurons synapse directly with motor neurons, or are there interneurons in the reflex arc? Ipsilateral or contralateral? Are receptor and effector on the same side of the body or on opposite sides? Innate or acquired? Are you born with the reflex, or do you develop it after birth? So we have our stretch receptor here and our quadriceps. Once you have that basically a patellar impact in the doctor's office, testing your reflexes, and you have this monosynaptic reflex for direct communication between the sensory and the motor neuron, the stretch reflex here. So sensory neuron sends information to the spinal cord, and the spinal cord gives a motor response to the motor neuron, the effector organ, getting the quadriceps to fire and extend your knee. And then the polysynaptic reflex, we have a sensory receptor of the hand, like the touch of the forceps touching your palm, and testing a withdrawal reflex here. And so you have that information, sends sensory neuron, then senses the information, sends it to the spinal cord. The interneuron then integrates that information, sends a motor neuron, the response to the motor neuron, to the effector, and then we have the affect, and we have the effector organ, or effector organ here for the bending of the arm, or the biceps, in this case, pulling away from that stimulus. The 4 common spinal reflexes: the stretch reflex, the Golgi tendon reflex, withdrawal reflex, and the cross extensor reflex. The stretch and the Golgi tendon reflexes only rely on receptors, proprioceptors, A muscle spindle is a proprioceptor that detects stretch in a muscle. The spindle contains intrafusal muscle fibers innervated by gamma motor neurons and wrapped by sensory neurons. Fibers that are not within the spindle are extrafusal muscle fibers, innervated by large alpha motor neurons. When they're stretched, the spindle's sensory axon fires impulses that are conducted to the spinal cord. So your stretch reflex. It's a reflexive contraction of a muscle after it's stretched. The stretch is detected by a muscle spindle proprioceptor. When stretched, the spindle's sensory axon fires impulses that are conducted to the spinal cord. In the spinal cord, the sensory axon excites alpha motor neurons of the same muscle, causing a contraction, that's monosynaptic. Simultaneously, the sensory axon excites interneurons that inhibit motor neurons of antagonistic muscle. That's the polysynaptic reciprocal impression. The opposing muscle, the antagonist, is basically excited in this case. Getting it to not respond. Stretch reflex classified as the spinal, somatic, monosynaptic, ipsilateral, or innate. And the stretch reflex here, get a little closer on this one. So we have muscle detects a stretch. Muscle spindle detects a stretch, meaning the length of the muscle is either extending beyond what the muscle is wanting it to do right now. These muscle spindles are regulating the length and the rate of change in length if they don't like it, so to speak. And it's going to basically, this muscle spindle here, these motor nerve endings to the muscle spindle are here, and our alpha motor neuron endings to the extrafusal muscle fibers here. And we have our intrafusal muscle fiber here, extrafusal muscle fiber here. and all of our sensory nerve endings. So this information is going to send this muscle stretch, stimulates this sensory nerve signal to travel to the CNS, and we're going to go to this spinal cord here with interneuron there, giving information here for the alpha motor neuron to extrafusal muscle fibers here, and we have the motor neuron to the muscle spindle here. And we're going to get the base of these triceps to do their job. Alpha motor neurons transmit nerve signals to extrafusal muscle fibers, resulting in contraction of the muscle in response to being stretched. Tightening it doesn't like being stretched that far that fast. Meanwhile, in the antagonist, interneurons synapse with alpha motor neurons to antagonist muscles, inhibiting muscle contraction. That's reciprocal inhibition. When one muscle fires, the opposing muscle must relax, or has to do less and less the more and more involvement you get of the opposing muscle. And with the Golgi tendon reflex, they prevent muscles from contracting excessively. Golgi tendon organs detect excessive tension. They are proprioceptors within sensory ending at the muscle tendon junction. Their sensory axons excite interneurons in the spinal cord. Some excited interneurons inhibit motor neurons of the same muscle. The muscle relaxes in a polysynaptic reflex, preventing it from damage. Some excited interneurons excite motor neurons of antagonist muscle, like in reciprocal activation, whereas antagonist muscle contracts in a polysynaptic reflex. And then for the Golgi tendon reflex, we have a little closer look in here. We have muscle contraction increases tension to tendons detected by the Golgi tendon organ at the muscle. Here's our tendon, here's our Golgi tendon organ, axon of the sensory neuron, and the muscle contraction stimulates the sensory nerve signal that travels to the CNS. And we have the sensory neuron here coming to our spinal cord here. Sensory neurons stimulate those interneurons within the spinal cord. Here we have our alpha motor neuron and our alpha motor neuron to the antagonist muscle. And we have in this case the quadriceps muscle is told to relax because there's relief of tension on the tendon. And meanwhile, and that was based on the interneurons inhibiting motor neurons to the muscle here, 4A. And we have, after that motor neuron sent information to the antagonistic muscle here, we actually have basically the interneurons stimulating alpha motor neurons to antagonist muscles. The muscle contracts in reciprocal activation here. Reciprocal activation, not inhibition. Inhibition meaning it would not be doing its job. Activation, obviously, firing. Spinal reflexes, the withdrawal reflex, pulls a body part away from a painful stimulus. The stimulus excites the nociceptor sensory neuron that transmits signal to the spinal cord and excites interneurons. Interneurons excite motor neurons of the flexors, so flexor muscles like the hamstrings contract and limb is withdrawn. And then simultaneously, other interneurons reciprocally inhibit motor neurons of extensors, so the extensor muscles like the quadriceps relax and withdrawal happens quickly. A cross-extensor reflex occurs in conjunction with the withdrawal reflex. Some interneurons are excited by the nociceptor sensory neuron crossing the midline and excite that extensor motor neuron on the other side, like the left leg is withdrawn, the right leg's quadriceps are excited. It allows the opposite side limb to support body weight while the hurt limb withdraws. In this case, here's our withdrawal and cross-extensor reflex. Actually, it's down here. Here's our painful stimulus detected when you step on something. The sensory neurons during withdrawal reflex, stepping on a sharp rock or a tack or something like that. Now we have our quadriceps here, hamstrings there. Quadriceps extend our knee and the hamstrings, of course, flex our knee, right? Bringing it toward us. We're just going to bring it away with extension. So in this case, then we're going to get this response here. After 1 here, I'm going to go up. We're going to get this response to the motor neurons. I'm sorry, the direction here. Sensory neuron here, guy coming over here. Sensory nerve signal detected by the interneurons. And their interneurons and send information, motor neuron to flexors here. And we also have other interneurons that cross to the opposite side and stimulate motor neurons to extensors on the other side of the body. So we're talking about here, information coming across here to get our extensors, these guys, to fire on the opposite leg to help us balance. Basically our quadriceps primarily, hamstrings also playing some role in trying to keep our help with the extension of the hip, but really it's our quadriceps helping more with that knee, but there's some isometric response trying to keep that stable, and we actually could argue the glutes are going to fire here to really be more so than the hamstrings are. That's really more the case in the quads specifically here. In this case, quadriceps femoris is basically going to be having to relax, hamstrings going to fire, trying to pull this foot away. And that is our withdrawal and cross-extensor reflexes. Got leg balance on this side, got some muscles firing over here on the opposite side of the body, as well as those that are trying to help withdraw from this response here of the tack or the rock, whatever you're stepping on. For reflex testing in a clinical setting, reflexes are useful for diagnoses. They can test function of specific muscles, nerves, spinal segments. The hypoactive reflex, it's lesser, hypo, right? Hyper would be increased. Diminished or it's absent. They may indicate damage to the spinal cord or muscle disease or damage to neuromuscular junction. Hyperactive reflex, it's abnormally strong response. May indicate damage to brain or spinal cord, especially if accompanied by clonus, which is the rhythmic oscillating movements with reflex testing. Something that is rhythmically oscillating would not be necessarily a good thing. So what did you learn? What are the four main properties of reflex? Identify in order the 5 steps of a reflex arc. How are somatic reflexes and visceral reflexes distinguished? What's the major difference between monosynaptic and polysynaptic reflexes? And that is the end of our chapter 14. I'm sorry, 3 more objectives. What are the 4 common spinal reflexes? Don't forget these important objectives. Identify the Golgi tendon reflex, which is an innate reflex, as A, spinal or cranial, B, somatic or visceral, C, monosynaptic or polysynaptic, and D, ipsilateral or contralateral. And what problems could a hypoactive reflex suggest? And the last section of the chapter is on development of the spinal cord, and I'm referring to more spinal cord developing from the caudal neural tube and an embryo. It's just an area that we're not going to talk about this time. It's not like anything. It's not that it's not important. It's not vital at this moment. Okay? And that concludes chapter 14 on the spinal cord.